Hi, welcome back to Rohrich Knows Podcast. This is Dr. Rohrich. I'm a board-certified plastic surgeon from Dallas, Texas, helping you become a better you and a more informed you. Well, let's talk about a recent hot topic, Barbie. And who is Barbie? Margot Robbie. It's amazing. I never, ever thought I would go see this movie, but my daughter was home and she said, let's go. So I went, and it was, I must say, it was intriguing. It was far better than I thought it would be. And Margot Robbie is phenomenal. And so I'm going to talk a little bit about her, a little bit about her career, and plastic surgery. Now, I'm not a plastic surgeon, but I'm going to comment about some of the things that are in the media about what she may have had. And some people kind of have gone overboard about what she's had. And I'm going to kind of level the playing field from my perspective as a plastic surgeon. First of all, she's beautiful. You know, she looks absolutely amazing. And what people decide to do and have in their life as a plastic surgery is totally their decision. So you know, kudos to anybody who's had or has not had plastic surgery. So she's quite amazing. You know, she's 33 years old. She's Australian. She's an actress and producer. She's really done some amazing things. You know, she's been nominated for 2 Academy Awards, 4 global Golden Globes, and 5 British Academies. So she's pretty amazing, and she's quite influential. And I liked her in the Barbie movie because she was very, very even-keeled, and I thought level-headed. And I thought it was perfect. You know, and again, I have not seen or been around Barbie, except, of course, raising my beautiful daughter, Rachel. And but I must say, it had some amazing points. But let's talk about, you know, Margot and what she may have had or considered to have had. I mean, she's quite beautiful. I mean, she's been on the screen, you know, since 2008 when she was in Australia. And, you know, she's a natural beauty, of course. And, you know, you can see that. And I think what gives her that natural beauty is her unique look. She's got strong brows. She's got almond-shaped eyes. She's got a nice, square, beautiful face, beautiful smile, high cheekbones that are innately hers, and her lips. And I think all those are natural. Now, as we age, when you look at somebody, you know, when in 2008, and then now, as you can see here, you say, has there been some changes? Well, of course. You know, most of it is aging. And when you look at her in 2008 arena, she's got a fuller face, her eyelids a little fuller, her nose is a little less defined than it is today. And when you look at the Barbie photo, yeah, there's been some changes. And so what do I think as a plastic surgeon? I think she's undergone some changes, and let's just go through them. When you look at her face, what strikes you? I think what strikes me is the changes in her nose. I mean, her nose, it was a little more less defined than it is today, and it's much more refined. The tip has been refined, the dorsum's been refined, and I think that's really, I think, a nice addition to that. And so I think she's had a rhinoplasty. And as a rhinoplasty expert, I think that's a high probability that she's had that. And also, when you look at her eyelids, you can see that she's had some fullness in her eyelids, and I think she's probably undergone a blepharoplasty as well. Now, of course, in all of her photos, you can see her eyebrows are elevated, and I don't think she's had a brow lift. I think she's had Botox or a neuromodulator. And I think one of the most distinctive things she's had is she's lost facial fat, and everybody loses facial fat as we age. But I think she probably has had buccal fat removal. You can kind of see that as she's aged, and you can see it's fairly distinct. Now, along with the buccal fat removal, she's also had, she's got beautiful cheeks, and I think she's done some cheek fillers in those areas, and I think that's quite becoming. I think sometimes the photos may show that she had more cheek fat loss than others, but I think she's definitely had some more definition in her jawline. She could have had some jawline filler, buccal fat removal, some highlights in her cheeks, and then, of course, some lip fillers. And I think they've all been elegantly done. And I think when you look at somebody like Margot that actually is beautiful to start with, the key is, does she have any distortion in her face? And I would say no. I think that she looks good. So whoever has done her fillers and her surgery has done, I think, quite a good job, which I think sometimes is unusual, especially for someone who's as famous as Margot. So I think that she has chosen wisely in having, her fillers and her minimally invasive surgery, her eyelid and rhinoplasty and buccal fat done in sequentially as she ages. And I think this portrays something that, like, before she's had a lot of surgery, she had a fuller face. It was more square. Now it's more angular. And I think that really portrays not only the accurate use of skincare, but also cosmetics to highlight her eyebrows, along with Botox to give her a nicer shape to her eyebrows. And then the discretionary use of lip fillers has also been good. And then highlighting her nasal features as well. So I think all of that, has been done quite elegantly. So I would say that rather than to criticize her, I would say this is something that really is very, very popular and very well done. And I would say kudos to her. And when you look at her before and afters, again, from a different timetable and different perspective, you can see that she's had an elegant shaping of her jawline, and she does have more hollowing of her cheeks in her malar area, and I think that's from the buccal fat removal. So I think that's a good thing. So when you look at Barbie in the movie and then Barbie highlighted, you can see that, certainly she's a beautiful 33-year-old. She does have some early signs of aging, especially around her eyelids and her, and I can see that actually is very elegant. But the big take-home message here is that it's not overdone. And I think that's a good thing. I think that when people are overdone, overfilled, they look weird and different. And I think you don't see that. You don't see that in Barbie the movie. You don't see that in her in real life. And certainly you don't see that in the doll either here. So I would say the take-home message here on Margot Robbie is she's beautiful to start with. So I think that's superb. And she's had a lot less plastic surgery than is talked about on YouTube and less than anticipated, in my expert opinion. And I think it's been subtle, but very powerful. And that includes her refinement in her rhinoplasty, her eyelid surgery like we talked about, and then her discretionary use of fillers in her lips, her cheeks, and her jawline. And then, of course, the use of Botox. And, of course, less is more. So I would say kudos to Margot for actually allowing to take control of her own face and say, hey, I want to look as good as I feel, but I don't want to look different than I am today. And I think that's a very powerful message because she's obviously a big role model, and certainly going to be a bigger role model now that she's, have this hit movie Barbie. So I might say hats off to Margot for really displaying restraint in all the plastic surgery that she's had. And I think that is a good lesson. That is very, very much of an anomaly in Hollywood where people tend to go overboard and do things that don't look good. And I think that doesn't serve well, especially when you're trying to be a very powerful and impactful role model. So less is more. There's a lot of lessons here. Know before you go. And when you're considering doing these, the common guide for this is a board-certified plastic surgeon that's going to show restraint, that's going to care about you, your individual aesthetics, your individual beauty. That way, you can actually get the best result possible. Because most of the time when I see patients like this, I actually restrain them and say, hey, this is all you need. You don't need more. We can do more later, but less is more, and you have to bring back or bring out the beauty in that individual, not change it. Remember, we're in the face protection program, not the witness protection program. So know before you go, and hopefully this was helping you become a better you, a more powerful and educated view about having any type of procedure done, whether it's skincare, cosmetic, medicine, fillers, or Botox, or even cosmetic surgery. So please give us your comments. We welcome them, and it's always a pleasure to have you with us on Rohrich Knows Podcast. Till next time.